Young Epilepsy is the only organisation working exclusively for young people with epilepsy. We are particularly concerned to campaign, to raise awareness and understanding, in particular within the education system. We believe there's a great deal more that can be done to support children and young people in school and in college to help them achieve the very best outcomes that they can. Our other area of big concern is the NHS healthcare service. Often it's inconsistent and often children aren't seeing physicians of the right sort of expertise or receiving the service that they require.
Here at Young Epilepsy, we work to support children and young people with epilepsy from across the UK, along with their parents and carers. They very often come to us in the first instance via our helpline, where we offer them information and a range of resources that can help them to understand this complex condition. We're fortunate to have a world-class medical facility at our headquarters in Lingfield, Surrey, where we conduct diagnosis, assessment and treatment services for children and young people with epilepsy from across the UK. Our consultant team all have links with Greater Ormond Street Hospital and University College Hospital. Led by Professor Helen Cross, the Prince of Wales Chair in Childhood Epilepsy, the team are involved in groundbreaking research into children and young people with epilepsy.
Epilepsy is a condition where individuals are prone to recurrent epileptic seizures. An epileptic seizure is a change in movement or behaviour, the direct result of an electrical change in the brain. They're unpredictable, they can occur at any time. The problem we have is that epilepsy is not a single condition, it's a symptom, and there are many different causes. It is particularly prevalent in young children, especially very small children, with around 80 per 100,000, and the incidence goes down as children get older into adulthood to around 40 to 50 per 100,000.
Elliot's diagnosis of epilepsy has been quite a long journey for us. He had his first seizure at the age of 3 months, and then he didn't have another till the age of 5 months. At the age of 5 years old, his seizures changed and we were then diagnosed with proper life-threatening epilepsy. I was absolutely devastated. Basically didn't know where to look, where to go from there. But on the whole, I just have to basically stay strong for Elliot, for the fact that, you know, each day we might not actually have him. St Piers School has provided Elliot with an education tailored to meet his needs. It has everything that Elliot needs under one roof, with all the therapists that are involved with Elliot. They are approachable, they give me advice when I actually need anything. The school provides Elliot with a lot of resources that he wouldn't receive if he was at a mainstream school.
The main thing really is that I haven't been able to take my health for granted anymore, sort of having to take regular medication in a way. It's sort of, you know, I've never had to do anything like that before. It's having to, you know, visit a neurologist fairly regularly. It has been quite frustrating in a way. Also, yes, losing my driving licence. I was literally about 2 weeks after I had my first seizure, I was due to take my driving test, and I was quite confident I would have passed, but now I've had to give up my driving licence. I still aren't able to hold a driving licence legally. It's also had sort of future implications for my career, because at the time I was very interested in joining the police, and I still am to an extent. And it has sort of raised questions about whether that would make that less likely, whether that would be less possible in the future. But I mean, overall, I am quite lucky. It is well controlled, but it is something I always have to bear in mind.
When an individual's been diagnosed with epilepsy, the first line of treatment that is considered is medication, anti-epileptic medication. There is a range of different medications, some known to be more suitable for certain types of epilepsy than others, and the type of medication will be selected on that basis, on the basis of the diagnosis of the type of epilepsy. The medication suppresses the tendency to have seizures. It doesn't take away the underlying cause, and therefore it's not like a course of antibiotics whereby you take the course and the infection goes away. With epilepsy, you have to keep taking the medication in order to prevent the seizures. Dependent on the type of epilepsy, there may be a tendency to grow out of it, so in time it may be that medication can be weaned if they've been seizure-free for a period. But actually in many cases, particularly if the epilepsy comes on in teenage years, the medication will be required long term. In certain number of individuals, surgery may be an option, but in others it may be that dietary treatment may be an option, or in some, where epilepsy is quite complex, vagal nerve stimulation.
We've done a lot of work to produce information. There's a huge need both amongst professionals, amongst parents and young people themselves to really understand epilepsy. It's something that a lot of people know of but don't know anywhere nearly enough about.
The vast majority of my friends and people I've encountered have been perfectly fine with it. It's never ever been an issue. My best friend, for example, is a medical student and she actually wants to be a neurologist, so it has been quite useful for her to sort of ask me questions about it. I think the majority of people who sort of have an issue with it isn't because of any discrimination or any prejudice towards it. It's mainly just because of a lack of knowledge. For example, last year I went to a nightclub and it had a lot of strobe lights, and my friend was sort of, oh gosh, you know, are you going to be okay? Is it going to be fine? And it's sort of, a lot of people just assume that the majority of epilepsy cases are caused by flashing lights, which is not true at all. My family have, as the years have sort of gone on, it's been about 2 years now, have become a lot better. They're not as overprotective at all. You know, moving to London has been a big step and it would potentially, you know, worry them, but they've been fine about it. It rarely mentioned with my family.
We do try and do normal things like other families, but again, as I said, we live for each day. We wake up and then we actually decide we can't actually plan anything anymore, you know, to go out, because, you know, quite often I plan something and I'm not able to do it for the fact that Elliot's epilepsy has affected it, you know, affected us, that we can't actually go out. You know, I do feel quite supported, really. I have very good health professionals involved with Elliot that are at hand whenever I actually need advice or I'm not quite sure about something. I also get quite a lot of advice from the health professionals at Young Epilepsy, who also yeah, are at hand whenever I actually need any advice and are quite willing to help.
Epilepsy is not a single diagnosis. More accurately, we should call them the epilepsies. There are many different types of epilepsy and many different causes. And indeed, we are gaining an increased understanding of the different causes of epilepsy, which will hopefully lead us to better treatments. If seizures are continuing in a child and it's really not clear the underlying diagnosis or cause, then the family should have the opportunity to discuss the epilepsy with a tertiary expert with regard to the condition. And in children, this would be a paediatric neurologist with an expertise. In adults, an adult neurologist. This is so that we can give them as much information with regard to expectations as possible and make sure that they have been trialled on the appropriate treatments.
Young Epilepsy is particularly campaigning for change in the areas of health and education and the provision of information. In health, we are very determined to develop a new care pathway for children with epilepsy so that they are seen by the doctors and experts of the right level of expertise, so that they're receiving the very sort of particular care and treatment that is appropriate for them. At the moment, this is really inconsistent. And in schools, we know that there is research to show that something like 50% of all children with epilepsy don't achieve their full potential in school. Often their needs are misunderstood. The teachers and care staff don't know how to support them properly. So we're doing a huge amount of work to try and raise the understanding amongst teachers and support staff in school to better see children achieve in school. So all of this means that this all has to be backed up with really high quality information, and either we as an organisation can provide that, or we can signpost people onto where they can get the right sort of information that they need. Young Epilepsy is here to help our professional colleagues within the health service. We have a fantastic range of diagnostic, of assessment and treatment facilities. We have a lot of information. We are determined that epilepsy shouldn't be a barrier to any young person in achieving the outcomes in life that they want. We know that with the right help, with the right support and the right treatment, many young people can achieve great things despite their epilepsy. So whether it's information, whether it's training, whether it is support, I think Young Epilepsy has a great deal to offer. We can be contacted through our helpline or through our website at youngepilepsy.org.uk.